we vaccinate all the time, whether it's flu shots, whether it's routine childhood immunizations, whether it's shingles vaccines. You know, we've got pharmacies, we've got healthcare workers, we've got frontline clinics, doctors' offices that are equipped to do vaccination. The problem is getting the vaccines to those endpoints. So one of the complicating factors is definitely that in the case of the Pfizer vaccine, it has to be kept ultra cold. And so that affects, like, how do you transport this? How do you keep that cold chain? You can't, you know, it's not like a regular vaccine that you can keep in the fridge where you can send the local pharmacy, you know, their entire season shipment of vaccine at once and just say, well, stick it in your fridge and use it as you need to. You have to be doling this out in continuous small batches so that you're not spoiling or wasting any because the cold chain is broken. So right from, you know, manufacturing and formulation issues all the way through to just making sure that those trucks with the vaccines are reaching the places where people will be going to get those vaccines is super important. And I saw an interesting statistic, I can't remember it, the exact number, but it was a really surprising proportion of the United States population that lived more than, I think it was an hour or two drive away from a pharmacy where they could go to get vaccinated. And so you think about rural populations, if you're a health clinic that's receiving a batch of vaccine and you have to use it all up, you don't want to waste any, it could be really difficult for all the people that you could vaccinate to actually reach the clinic. They might have to drive an hour, 2 hours, 3 hours to reach you. They have to come back and do it again for a second shot. You might have enough vaccination to vaccinate, or enough vaccine to vaccinate 100 people, but how do you get all those 100 people coming in to see you in the time frame that you can keep that vaccine cold for? There's a lot of challenges, but I think a lot of those will get resolved not only with time as we sort of improve supply chains, but as more vaccine candidates are approved for use that are more traditional formulations that you can just, you know, slap it in a fridge and it's fine. They don't have to have this very precious cold chain. I think that's going to solve a lot of problems and just changing formulations for some of those vaccines. But yeah, for now, it's a challenge.